Hi, I'm Dr. Sanjana Vatsa. I am a cornea and refractive surgeon practicing at Dr. Agarwal's Eye Hospital in Indiranagar, Bangalore. I mainly specialize in corneal surgeries and also refractive procedures, and I have been associated with Dr. Agarwal's for almost more than 7 years now. Star Surgical has been extremely dedicated in bringing about newer innovative technologies in the field of ophthalmology, and one of their pioneering work is in implantable Collamer lenses, also called ICL. So this has literally revolutionized the field of refractive surgery. The Star Surgical has been constantly working on bringing newer innovations and also to bring about improvement in the patient visual outcomes as well as the overall patient satisfaction. So there are various options for refractive surgery, starting from the laser-based procedures and also the lens-based procedures. So the laser-based procedures would be suitable for many people, but there are a set of people who would not be suitable for laser surgeries, especially if your cornea is very thin or if you have a very high refractive error or any other condition in the eye where you would not be suitable for laser procedures. We would go for ICL. Now, ICL is an excellent option, especially for those who have very high refractive errors and even for those with the lower powers as well. Even starting from -0.5, the ICL procedure can be performed. Even if there is any possibility or if any circumstances wherein we have to remove, it can be easily removed through a very small incision. And these are very safe lenses. They are made up of a very good material, biocompatible material called Collamer, which is highly biocompatible with the eye and the structures inside the eye. And these lenses are extremely thin, so thereby implantation is very easy. And if we have to remove it in any circumstances, it can be removed without any problem. Star Surgical has a patented technology where they have come up with the implantable Collamer lenses, which are made up of a material called Collamer, which is basically a collagen copolymer. So this is highly biocompatible in the sense it mimics the structure inside the eye. Not only these lenses are extremely thin, so the implantation is also very easy. And in circumstances where it has to be removed, it can also be removed very easily through a very small incision without causing any damage to the structures inside. The Star Surgical team has been extremely supportive right from the beginning. So initially, for any young ophthalmologist who would be interested in performing the ICL procedure, the Star Surgical would provide them the training in the sense how to load the lens, how to implant the lens, and also they would be present with the doctor during the surgery, during the implantation, and make sure that the surgery goes well and the patient also gets the right outcomes. So every ophthalmologist should be familiarized with the option of EVO ICL. They need to understand as to which patient would be suitable and how is the procedure being done, what are the pros and cons, and what are the post-operative outcomes. Not only this, it's extremely important to educate the patients as well that this option is available out there, which is extensively safe and also effective in correction of their refractive errors. So there was this patient who had a very high refractive error, and the patient was wearing glasses and had tried contact lenses as well, and the patient was more into physical activities and wearing glasses was very uncomfortable. And at the same time, wearing contact lenses for a long time was also not a very good idea because it was causing a lot of dryness and the patient was highly uncomfortable and wanted to go for a permanent cure for this. So we offered this option of ICL after a thorough investigation, and the patient was suitable for the procedure as well. And following the implantation, right from day one, the patient was extremely comfortable, and within a week, the patient got the complete vision what was being expected, and in fact, it was much better than what vision the patient had with the glasses. And the patient was very satisfied with the overall outcomes, and he is now performing his normal activities without any hassle. So incorporating ICL will always extend your horizon, and also it provides multiple options for the patient whenever they think of getting rid of their glasses, particularly for those people wherein the laser-based procedures are not an option. So yes, with the option of ICL, we can add more and more patients who would get benefited with the refractive surgeries. I would like to congratulate the Star Surgical first of all for this entire journey of 30 years, and extremely thankful to them for all the innovations that have done in the field of ophthalmology, and expecting much more to come in the future, and would always be happy to collaborate with you to provide the best possible surgical outcomes for our patients.